So we want to make it as easy as possible and remove as many barriers as we can.
A new effort to get the COVID-19 vaccine to neighborhoods where it is needed. In a little more than a week now, a mass vaccination site will open at Cleveland State University's Wolstein Center. Federal officials picked that location because it's close to neighborhoods hard hit by the pandemic. News 5's Jay Jarvis explains how it will have a critical impact on those underserved communities.
I hate to use the term lightly, but it's really a game changer.
And a huge step forward in the fight against COVID-19. The mass vaccination site at Cleveland State University's Wolstein Center is set to open on March 17th. The location chosen by the White House because it's central and accessible, but still in a medically underserved part of the city. Of the 25,000 people who live within 1 mile of the center, 66% are minorities, just under 7% are elderly, and almost 45% live in poverty. Cleveland Department of Public Health Medical Director Dr. Lynn Milliner says the impact of COVID-19 on those communities is devastating.
We're a lot sicker. We are more likely to be hospitalized, be in the ICU, been on ventilators, and unfortunately, make up a larger portion of the population that suffer fatalities from COVID.
Dr. Milliner says since the vaccine rollout started, officials have been trying to get to people in those communities in several different ways, like mobile and stationary vaccination pods. But they realize people can't always get there.
And having one large stationary pod where everyone can have access to it, we have set hours, have set number of vaccines that we can give, that are in large numbers over a period of time is really going to be impactful in getting the vaccine to the people that need it most.
That news welcomed by Keo Cummings, the pastor of Ebenezer Assembly of Christ Church in Cleveland's Lee Miles neighborhood.
When you look at minorities and specifically African Americans and Hispanic, they are in need of this help.
He says he and other pastors are doing their part, encouraging their congregations to stay safe and get vaccinated if they can. But they're concerned about how people in underserved communities are able to get to vaccine clinics and wanted one in a more centralized location.
If you put this on the bus line, if you put this in the inner city, now you got those people that are dealing with this health access that they could not get to. Now they have access to it.
Now with a site in walking distance for many and options for transportation through RTA and rideshare services, he's hoping that means more people will be able to get vaccinated and stay healthy.
So now we're trying to bridge that gap, and I'm glad to see what's happening.
In Cleveland, Jay Jarvis, News 5.